My name is Blase Vanguard. It's been me and you for the past hour. And now we get into the second hour. And this show is a special one. We're talking all about mental health in collaboration with the National Health Service for London. London, you good? It's all about young people and mental health, especially at this time of year when so many people are traveling to London for school and they're dealing with so many different things, new challenges, new pressures. Sometimes maybe it feels hard to express those things or, discharge those feelings. We have two very special guests here. We got Femi, who's a peer support worker at Chase Farm Hospital. And we got Michelle, who's head of occupational therapy for mental health integrated network teams at West London NHS Trust and clinician. Is that right?
Yeah, clinician trainer.
Clinician trainer for the People Like Us project. I want to thank you both for being here. First of all, Femi, Michelle.
Thanks for having us.
Yeah.
Really happy to be here.
Yeah. Well, from what I'm getting, this is, for the two of you, this isn't regular stuff being up here in the radio station, right? How y'all enjoying the experience?
Yeah, no, it's great. I mean, I'm definitely not a regular, so yeah, I appreciate the opportunity. It's always good to raise mental health awareness. Where possible. Thanks for having us on your platform, man.
No, it's good to have you both here. Thank you so much for being here. How about you, Michelle?
I will actually say I used to listen to Reprezent radio in my car when I had a car. Yeah, honestly. So it feels really nostalgic.
This is good.
I'm loving it. Thank you.
Okay, fantastic. Gosh, look at this weather. Huh? Skies are gray. Maybe some people feeling like how this weather looking, but we're gonna chase them blues away with a nice talk. So, first of all, I'd just like to ask both of you, and Michelle, we'll start with you, and then we'll go over to Femi. Just give me a little bit of your background and what drew you to this field.
Yeah, so I studied occupational therapy at university, qualified in 2014, and I've just been sort of progressing in my career since then. I have a real interest in mental health. Specifically, it started from trying to support my mum through her own mental health. So she's sort of battled with quite severe anxiety disorder throughout her life and sort of a lot of sort of childhood trauma. So it was really nice that I could give back to her and try and support her, as I saw that she really was struggling throughout my sort of youth and growing up.
Yeah.
So I've always had a real special interest in mental health, especially the fact that we all have mental health.
Definitely.
Mental health's on a spectrum. We have good and bad days. We have good and bad times. And I'm really interested in supporting individuals with their mental health and trying to keep mine in check as well.
Yeah. And Femi, how about you, man?
I've got a real big passion for mental health. Not a lot of people know this. I mean, I'm sure some of your listeners listening in now don't even know this, but off the back of uni, so my original path was business administration with accounting and finance. And just the pressure got to me. I felt like I was always running behind and I should be achieving higher and more. And I was trying my hardest to get first. And the pressure from that, because I don't want to be misunderstood here. And it's not just the pressures from uni where you don't think you're doing well. I was actually doing well. And thankfully, I got a 2-1 at the end of it. But that summer holiday actually fell on well from all the pressure and the stress. And I ended up in mental health services myself. So
that's school pressure, man.
Yeah, man. Yeah. It's the pressure you put on yourself. Pressure to me might be something totally different to the next person. And ultimately, it got the better of me. And I ended up in services. I battled back. I worked with, did a lot of talking therapy. That was my safe haven, my safe place. And I got the opportunity to sort of take a career path change. And off the back of assuming I was going to be, the biggest accountant out here, you know, with the crisis we've got going on. I was going to save lives in that way, but there was a calling, man. I got no better feeling than being able to help people going through mental health battles and traumas. And started off as a peer worker. That was in 2018. Then I progressed, and thankfully now I'm peer and lived experience manager for Barnet, Enfield and Haringey, which is in the North London, if any of your listeners ain't familiar with it.
Mm-hmm.
But yeah, man, it's just been an incredible journey. I'm happy to tell you more.
Okay, fantastic. My next question for the both of you, you know, for myself personally, like you said before, Michelle, you know, mental health is a everybody thing. Everybody deals with it. And, you know, I was just reflecting on my own experiences with my own mental health, just growing up. And gosh, how crippling it felt sometimes. And just the value of counseling, how nice it was to just talk to somebody who you feel like gets it. Or, you know, sometimes in turn, you are the one counseling with somebody, and you know, you're that ear for them to listen to. I'd really like to know, as we're just talking about the beginning briefly, for the both of you, how was your initial attitudes towards counseling, to sharing your pain with somebody? Because it's not easy for everybody.
Would you like to go first? Okay. Yeah, for me, there was a, you know, reservation there. Just, you know, it's a vulnerability. You're expressing things that you don't talk about. They're not on the surface, and just you don't know how people are going to react. What the outcome of having that conversation might lead to. And for me, initially, it was about the people closest to me. I was disassociating. I just couldn't. Like, I had my guard up. I couldn't tell them about the things I was going through. It's not a conversation. When people did say you good, I'll just take that as something tokenistic and say, yeah, I'm all right.
It's like, you know, how you doing?
Yeah. That's sort of the attitude we have towards that. It's never really, that should be a gateway to go and really tell me what's going on. And for me, being able to use mental health services with the NHS and really talk to someone, that really benefited me, because it wasn't people I was even close with. So there was confidential information I was sharing,
right.
And I didn't feel like it would get back and it couldn't harm me. That's the perception I had. It couldn't harm me. So just being able to vent sometimes it weren't even constructive. I was just like, these are some of the anxieties I'm facing, and you know, I just found that being able to vent and tick it off, and it really helped. Time and time after, I'd see that, you know, I'd be able to resolve and get to a solution with my problems.
That's nice, man. How about you, Michelle?
Well, I guess, it's really good to hear that you found talking therapy is really beneficial, Femi. I think one thing I just want to highlight is that it's World Mental Health Day on the 10th of October.
That's right.
And the theme of this year is make mental health and well-being for all a global priority. So really trying to encourage people to prioritize their mental health on par with their physical health. So I haven't engaged in talking therapies, but again, through sharing my mum's experience with everyone, she has regularly gone through cognitive behavioral therapy, talking therapies. So
you're on the other side of it.
Yeah. So I'm really on the sort of carer side, really trying to support my mum through her difficulties. And, you know, just I think the key is also the awareness. So ensuring that you're aware of what's available to you, because some people don't know. And, you know, the NHS does, there is the availability of talking therapies available to everyone for free. You know, we have something called IAPT, which the name is Improving Access to Psychological Therapies. And that's available to young people, to adults. So it's available, it's there. And it's just about making use of it and knowing that it's there.
Of course. Okay, fantastic. We're gonna take a quick break live on Represent Radio 107.3 FM. I got Femi and Michelle with me for the mental health special. How y'all feeling?
Yeah, really good.
Yeah? Okay, fantastic. So let's get back into it. Tell me, and Femi, we'll start with you. Tell me the demographic of people that you're working the most directly with.
Yeah, it does vary, but we are getting a lot of black, Asian, ethnic minorities within our services. I mean, I work, like I said, across Barnet, Enfield and Haringey, so essentially I'm working with so many different service users. I mean, we've got an elderly ward, we've got people below 40, so you see it all, and it's all different. I mean, I couldn't necessarily say there's a particular age range, because you'll find that between that age there's people and then there's people a lot older.
Right. So is every day different for you?
Yeah. So depending. So when I go to sort of forensic, which is in Enfield, I love working with the service users. I love hearing their stories. I mean, like I said, I always, it's all about representation, man. Being able to just say to them, look, I was a service user too, and they're like, cool, wow, what's your story? I'm like, you can get into it as well. There was a point in time where, like I said, I've got a financial background. I was going to turn my back on mental health and be like, you know what, even though it's worked for me, this is what I want to do. But I felt like there was a call in there. Just being able to sit down with the service users and discuss life, and, you know, you're not alone. This is not uncommon. I've been through it true. I know this guy's been, you know, on socials in a negative light, but Kanye West said some of the most beautiful thoughts are beside the darkest. And like, for me, that's
real, you know.
You can say, you've gone for a job interview, I'm gonna get this job, and the next minute in your head you're like, but what if I don't?
Yeah.
So these intrusive thoughts that service users are constantly having, it can go from, you know, overthinking to delusional thinking.
Yeah.
And then that's where it becomes a severe mental health issue and a severe mental problem. And just being able to break some of that down and get a second opinion. Yeah. Because, you know, if you're in your thoughts all day, that's the only person that's going to give you an answer. and that's a dangerous place to be. It's always good to, you know, seek a little bit of validation and calling these helplines, you know, the NHS urgent mental health. Go on the website. Yeah. You can speak to people who are trained in this profession. You can speak to people with actual lived experience in this profession, and it's so rewarding. Yeah, but so rewarding.
I just want to ask you one last thing, because when you was just speaking, you said something very interesting there. You know, you noted you come from a financial background.
Yeah.
But you said you felt like, it seemed like if you didn't, it sounds to me almost like if you did not make mental health like really a part of your life, you would have felt like you turned your back on it. Because you now just said that, you said you was going to turn your back on mental health, you know?
Yeah. So it's like, I call a spade a spade. It was a low moment in my life. For me, I kind of just wanted to not share and, you know, not have it well publicized, you know, because of all the stigma surrounding mental health. Yeah. There's a lot of more awareness these days, and it's getting to where it should be. I wouldn't say we're there yet, but it's on everybody's radar. But for me, it was almost like, okay, I've had that. I'm where I want to be, or where I assumed I would be in my recovery. Now let's chase this goal of, you know, becoming a chartered accountant. And no, that's not the right attitude, because I remember thinking whilst I was in there, who really understands me? And now more and more, we're getting more and more peer workers working within our services. You're getting that support and that validation. It's like, okay, cool. You can study all the books in the world, but he who knows it feels it. So
that's real.
So
that's
for me, it was about being a presence and being able to be reached. And I always told service users, look, I'm here whenever you need me. I've got a work phone number. Phone me, text me. I'll try to get you to that support, however it be, you know, and that's real for me. That was gave me a real warming feeling, knowing that I can support and still be supported.
I hear that. So Michelle, over to you. Tell me about the demographic that you work with the most closely.
Yeah, I guess so. That's sort of like a 3-part question, because I've got to be thinking about different hats that I'm currently wearing.
You wear many hats.
Yes, I am
You wear
wearing
many hats.
Yeah, many hats.
Mm-hmm.
So I guess if I'm thinking in my role as head of occupational therapy for the MINT teams at West London NHS Trust, so the demographic we work with is adults mainly, 18 plus, but we've recently extended our offer to 16 to 25, because we've noticed from the statistics and figures that a lot more young people are struggling with their mental health. And we're having a lot more young people presenting to accident and emergencies and, you know, emergency departments, A&Es, with mental health needs in crisis. You know, the figures are showing there's 6.9% increase since 2019. So that's why this London You Good campaign is so important and fundamental, you know, trying to support young people within London to access early intervention and support. And to know that they're not alone, you know. And I'm also involved in another project as a clinician trainer for the People Like Us project. And that's through the University of West London. For those of you that don't know, that is in West London. It's near Ealing. It's near Ealing.
West side.
That's where I live as well. So I really, that area is it's so personal to me as well. So it was just lovely to be involved in that project that's supporting students from a BAME background. So Black, Asian and minority ethnic to seek support. Because again, they're 10 times, the figures were showing they were 10 times less likely to seek support when they were struggling, you know? So we're really trying to reach out to the younger audience. We're really trying to reach out to young individuals struggling with their mental health, so that they know that there's support available, free support from NHS, and that there are people here that want to listen and want to help. Especially, you know, we've got Femi here who's a peer trainer. So people with lived experience also supporting, you know, that are further along in their recovery journey. You know, it's really lovely to see.
Well, I mean, it sounds like you were very much like, I guess, at the where it can be the best prevented, working with the young people, because I mean, mental health, it really starts that early, doesn't it?
Yeah.
You know, like, and like Femi was saying, there's a lot more acceptance around mental health. There's a lot more dialogue. There's a lot more words for things, you know, and I think we can all agree that we remember like feeling the feelings when there were no names for these feelings and just feeling very confused. You know, Michelle, it sounds like you have a lot of love and passion for where you come from. You know?
You mean my journey in my career, or you mean my
I'm
background?
talking about your community.
Yeah. I will say I'm a Londoner, you know. Lived in London since the age of 2, mainly around the west side. I grew up in sort of Portobello, Harrow Road, and also Wembley, so Brent. And
so
now,
what's it like being a young person in West London?
It's good. I don't know, I feel like really connected to West, but I think living in London, you travel around. So I'm often out in Brixton, so it's nice to come here, you know.
Of course.
But yeah, I feel really connected to the community that I serve as part of the NHS, and it's lovely to give back and help others.
I have a question for the both of you. You know, we were talking about how important it is. I guess I think we could all agree in our own experience that it doesn't really work unless you can talk to somebody who can like meet you at that level of either willingness to open up, or willingness to listen and receive, and empathy as well, you know, sharing an experience. I feel like probably without without that, would you say maybe empathy is the real cure for mental health?
Yeah, definitely. I mean, there's so much that goes on in the background with what people are facing, and just being able to bring them to a point where they're ready to open up, help them develop the insight along their recovery to be like, this is okay, and showing them that, yeah, you're not alone, this is about you. Take as long as you need, but this is what's available. And yeah, definitely empathy. It's not sympathy. You don't want to jump into the problem with them. You're saying, look, I understand your problem, and I'm here to support, and there's services here to support as well. I mean, we all went through the pandemic. We all know in some way or another how it's traumatized, affected many people's lives, and we're just still moving out of that. It can be overwhelming. People, like Michelle said, 16 to 25-year-olds are thinking about that next step in their future. They're thinking about university, moving out, where the next 3 to 5 months, maybe the next year, maybe the next 5 years will lead them really trying to find out what sector and services they want to work within. And that can be daunting. It can be a lonely road. It can be a very lonely road. And, it's not the conversation we have. It might not be considered as interesting at first,
especially for the indecisive, right?
Yeah. Because look, like I said, I revert back to it. The cost of living crisis. Nobody wants to make the wrong decision. You've got time on your hands. You want to really be like, how can I best be financially stable for the rest of my life? At 16.
That's mad.
At 18.
Yeah.
This is things that we deal with on a day-to-day basis, and people break down. They overthink the situation, and we're here to say, you know what? People have been here before you. They faced those same issues. It might not have been the pandemic, it might have been something different. But ultimately, there's support and empathy.
How about you, Michelle?
Yeah, I think, Femi, you just sort of hit the nail on the head. You said all the right, you said all the things I was thinking. Empathy, listening. I think that's the fundamental thing, like actually listening and hearing what someone has to say. One thing we like to talk about in the NHS is client-centered care. So we really want to put the individual first. We want to hear their story, hear what's going on for them and what their difficulties are. Because everyone's an individual.
Right.
And as Femi said, between 16 to 25, there's those fundamental sort of pivotal moments in your life. There's, as you said, interviews, there's deadlines, there's a lot of stressors. There might be things going on in your personal life as well. And it's about just trying to understand that person's specific story and really trying to support them to sort of build a mental toolbox of strategies they can use to help themselves and keep themselves feeling well. That's one sort of key phrase I always talk about. It's having that mental toolbox of strategies. Everyone should have that, whether it's going out to see your friends, whether it's, sports, whether it's fitness, we all have certain activities that help us with our well-being, and it's just about identifying what it is for you, whether it's your protective factors, your activities you do, your meaningful activities. It's just about building that sort of resilience for yourself.
I agree. I love that. Let's take another break.